This is my first experience at the conference. I'll be attending some sessions after manning the booths, so I'm liking it so far, but hopefully I'll kind of dig into the meat a little more later today.
I've liked it so far. I've been at the exhibition booth the past couple days, and especially yesterday and the first part of today, people have been coming through, and a lot of the different booths have had really creative demonstrations, so it's been really great.
It's been really interesting. This year the theme is on non-communicable diseases, which is a bit of a change from years past, but it is a growing need in developing countries, so it's been interesting. There's also a lot of work in HIV/AIDS going on here as well, which is the field of my organization.
I think the biggest challenge, absolutely, in the global health picture is the shortage of health workers. And we need workers to deliver all of the services and provide basic health care and do all the other things beyond that. And we know there's a big global health workforce shortage of 4.3 million workers, and countries are really struggling to meet the MDGs with the small amount of health workers that they have. So scaling up and doing the most that they can with the existing workers too is of huge importance, I think.
Well, certainly a lot of the MDG targets were purposely set to be ambitious, and it will be a major challenge to meet some of them, especially on the maternal health and universal primary education on some of them. But major progress has been made, so we should keep striving for those goals.
So when you're working with communities in the field and using their resources, like I know our organization for meeting some of our challenges, for example, makes use of social networking, and that's like an asset that's in the field that you can't create from outside. And so just tapping into those resources and those opportunities, I think, is the best way to go about meeting these challenges, and it's like an innovative way too.
Well, I mean, speaking of partnerships, I think MChip is a perfect example of a project where we have 5 or 6 different partners actually working collaboratively to achieve these goals in a variety of countries. So it's nice to not have to reinvent the wheel. If Japaiga already has an office somewhere, everybody can come on board and use those connections and that infrastructure that's already existing. So I think it's very cost-effective to do things that way, and it just makes sense when different organizations already have community relationships and they're already advancing projects that other people can jump on board and expand the program.
What's been nice about MChip is that, I mean, we're all in the same building, and it's nice to be able to walk across the hall and be able to share best practices and really talk about it face-to-face with a person versus something across the way. So that, I think, has been a real benefit as well.
Global health can be achieved by grassroots campaigns. Mobile technology is now a hot thing. I would drive viral campaigns, even through YouTube, podcasts, that sort of thing, to get the message out. Because obviously digital is the future, and that's where people are going to for their news.
So I think something like mHealth, taking things out of pilots and moving them into larger programs are very important when you're using technology that is basically already being used and you're just adapting it and growing it.
In my view, open source is key because that gives people in developing countries the chance to customize various pieces of software for their own context. So just one example I know about is for human resources information systems, health worker databases that ministries of health are now having to track and plan and manage the health workforce. Proprietary systems just aren't really useful to them. They, when the donor funding ends, they may break, they don't know how to use it. Something that's built on open source, they can customize for their own context. People in these countries know how to program an open source code, and they can really own it and sustain it. So I think that's always something to watch out for, because then you have the help of the open source community too going forward to figure out glitches and problems.